My name is Seun Tuyo. I work for Kantar TNS as a research manager handling the fintech, media and digital accounts. My exposure to malaria research started off early in the year, let me say the end of 2016 into 2017. As the lead for our corporate social responsibility for the office in Nigeria, I was trying to look at what initiatives we could do to have impact within our host communities. And so malaria was an option, HIV was another option, and tuberculosis. However, malaria popped up more because a lot is being done, but it's not reflecting in results. And so I went into trying to develop action points and points of view to prove why we should actually go into malaria. So that sort of ticked off my interest in malaria. It's actually a disease that is trivialized in our own community. With malaria, the typical Nigerian just goes into a store and buys a drug off the shelf. Half the time, you're not sure what you're buying. If it is fake, if it's good, if it's bad, you're not sure. Yes, there are some measures being put in place now to check all of that, but more can still be done. Malaria is highly endemic in Nigeria. According to the National Malaria Eradication Program Strategic Plan for 2014 to 2020, it accounts for about 60% outpatient visits, 40% public health expenditure, and around 30 to 40% hospitalizations. It contributes up to 11% maternal mortality, 25% infant mortality, and around 20% to under age 5 mortality. It is also responsible for up to 300,000 deaths annually. It is estimated that with a 50% global decrease in malaria incidence, we could make up to 10,000 naira in economic benefits for every dollar invested. So what that means globally is we stand to make up to 500 trillion naira per annum. But more importantly, we get to save 11 million lives. To achieve total eradication of malaria by 2035, first we have to evolve with this disease through thorough and constant research. And then we also have to take advantage of strategic partnerships, collaborating with leaders and influencers of economic, political, and social groups. Finally, we have to take advantage of the media on the public through targeted communication for public enlightenment. So I came up with the thought that 3 methods of approach we could do. I work in the research industry, so data is vital. And first off, the malaria parasite keeps evolving. So if we don't evolve with it, we're actually just fighting a battle we can't win. You find there's vaccine now for typhoid. Ebola came and was contained within a couple of months. We can do the same for malaria because it's a disease that can be prevented and controlled. How about we go in neck deep? Traditional rulers, social, private, political groups. How can we partner collaboratively and see how can these people now begin to listen and do just basic stuff to actually improve their lives with protection against the disease? And lastly, media influence. You see social media thriving these days. We can actually use those tools to influence the public on malaria prevention and control. I believe it is 100% preventable and controllable. I've been a victim of malaria several times, and I'm pretty sure quite a number of people have been. And I'm certain going to learn about policy making and influencing will have an impact when I get back, because I would know how to actually give back through the 3 processes which I've talked about. That's research, collaboration, and the use of media.